the CBT model, which prepared the protagonist to go into action. Efficacy results that the combination of the CBT and the psychodrama indeed does work well. It blends nicely. I'm embarrassed to ask. And if you're embarrassed to ask, what does that mean? Well, I really don't deserve a raise.
Hello, welcome to channel on Action Explorations. I'm Anna Bobikova. Our topic today is integrating cognitive behavioral therapy and psychodrama. Interview with Dr. Thomas Treadwell. Hello, Tom.
Hi, Anna. How are you?
I'm good, thank you. New online education alert. If you're studying psychodrama and would like to learn it online with pre-recorded video formats, please check out actionexplorations.education. Watch for detailed announcement at the end of this video. How did you come up with the idea of combination of psychodrama with cognitive behavioral therapy?
It goes back to the mid-90s when I did a fellowship at the Center for Cognitive Therapy at the University of Pennsylvania. And I learned CBT. That was a fellowship for CBT under Dr. Aaron Beck and Dr. Corey Newman. There is where I started to get the idea of the integration of the CBT model with the triadic psychodramatic model. And I did my first pilot study in 1999 with a graduate student, and we published our first results in 2001. The reason I wanted to integrate it was the warm-up process with the psychodramatic model didn't fit my personality really well. So I needed something different than the usual warm-up technique that either Dr. J.O. Marino would use, or his wife Zirka Marino, or any of the other psychodramatists. They would use sociometric techniques. And although I liked the sociometric techniques, I needed something better for me, for my personality. And that's where the cognitive behavioral model fit. And that's how I started doing it.
Is it possible for you to share what didn't fit you? What didn't you like?
Well, it was getting the client or the patient warmed up, ready to go into action. That was the part that was difficulty. Once you got to the protagonist ready for action, it was easy. It was prior to that. And so I was able to come up with the CBT model, which prepared the protagonist to go into action. That's what I did.
How it developed during the years?
Okay, the development happens to start with a very basic cognitive behavioral technique called the automatic thought record. And there are various automatic thought records. I chose, there's a 5-column thought record and there's a 7-column thought record. I selected the 7-column thought record because it gave me more data on the client or the protagonist. And what I wanted to show you is it is the dysfunctional thinking that we have as human beings that kind of set the stage for the warm-up. And so I challenge the dysfunctional thinking, and that's what gets me to a point where I can understand where the protagonist is and what direction we need to go in.
Could you please share the research on this topic?
Yes, really, way back in 1991, Robert Hemberg came out with an idea that cognitive therapy would work in a group setting. However, it was bare bones, and I kind of built on that. And then my publication in 2001 came out with my graduate student and a colleague. And after that, we published another paper in 2002 integrating CBT with cognitive behavioral therapy. And then after that, Zig Hamanshi in 2006 published another study on the integration of cognitive behavioral therapy and psychodrama, specifically with depression. And then after Hamanshi, I published another article with colleagues on the integration of CBT and psychodrama. After that, we had Jenny Wilson, who published a beautiful article comparing, not comparing, but identifying Aaron T. Beck and J.L. Marina, the two giants in the field, and how they actually thought. And she concluded that, they had an awful lot in common. Because some folks think CBT is very structured and very academic.
Yes.
And it is not. It's very broad and broad-based. And so Marino and Beck were on the same faculty for the American Psychiatric Association way back in the 50s. So there is some definite integration there, and Jenny did a good job in doing that analysis in 2009, and again she published the second article in 2011. Since those studies, we have a new one that just came out in this year, 2020. Two studies, one by Hannah Aberini, and she compared the exact same model, my model, the CBT and the psychodramatics model, and tested role-playing and role reversal in it. And so there we have some really good efficacy results that the combination of the CBT and the psychodrama indeed does work well. It blends nicely. And we're also getting some nice data in psychodrama that role reversal and role reversal and role playing does show effective results. So that's that. So the research is pretty good.
That's wonderful. Could you please share how do you combine these methods and what are the practical ways to use them?
Okay, well, for today, I use a 7-column thought record, but for today, I am just going to show you the first 3 columns because that would be enough. Once you're working with a group, once you get to know the group really well, you can really only use the first 3 columns. However, for teaching purposes, and when I'm running a group, I will use all 7 columns. So that gives me and the group a lot of data about each person in the group. So we get to know a lot about each group member. So for teaching purposes today, I'm just going to show you the first 3 columns. There, you see, we have a situation, we have moods, and we have automatic thoughts. So in this particular case, I was told to ask my boss for a raise. Oh, and his moods, he's very anxious, he's very scared, he's very nervous. Okay, so that's the moods. So first you get the situation that the person, he's having difficulty talking to his boss. Then you ask about the moods. So you get a mood and you rate the moods. He's anxious, he's scared, he's nervous. And it's on a 10-point scale. So anxiousness is 9, so he's really anxious. Scared, he's a little bit less back, but he's really high up there. So he's, and the automatic thoughts, these are negative thoughts that we will not want to share with anybody. They're only internal negative thoughts that we tell ourselves. And it's up to the facilitator, the director, to get the person to say, okay, what are the immediate thoughts going through your mind? And someone may begin by saying, oh, well, I think it's this, or we did. Say, no, it has to be, we want I statements. So we get him to say, I'll make a fool of myself. And then I will say, well, making a fool of yourself, what does that say about you? I'm embarrassed to ask. And if you're embarrassed to ask, what does that mean? Well, I really don't deserve a raise. And if you don't deserve a raise, what does that say? Well, I'm doing excellent work, but I still don't deserve a raise. And then another thing I would say, okay, if that's the case, then I failed to send my progress report in on time. It was 1 minute late. This tells me as a facilitator director, okay, this guy's he has the ability, he has the confidence to do it. He's just scared to death, perhaps of an introverted type of an individual. So I'm looking and I ask him again, well, all of this, what we put down, I'm going to make a fool of myself. I'm embarrassed to ask. I didn't deserve a raise. What does this really say about you? He says, I'm not worthy. I'm not worthwhile. And that comes into the helpless core belief that he's just unwilling. He's not very good at helping himself. And it may be the failure schema that I'm inadequate. I'm not competent. So there we set, that has given me that's the warm-up that I have, and now I can put this into action. So that's how I do it.
Okay, wow. So, and the full table people can find in your book, is it correct?
You can find this in the book, yes.
We are going to do the demo. If you'd like to learn psychodrama online from leading trainers, affordably and at your own pace, go to actionexplorations.education. This is my project to expand access to the best trainers in the world. It's my baby. We are working with the leading psychodrama trainers to present pre-recorded programs. The programs will include lecture, cases, and evaluations. There will be a large selection of action exploration subjects. I'm going to add from 5 to 10 modules per month, so the content will be very rich. We discussed with Dr. Thomas Treadwell to do the full course of a combination of CBT with psychodrama for action explorations education, and we agreed to do this. Please keep watching and checking Action Explorations Education, and the program will be there shortly. Namaste.